This Action News Jax Family Focus Special is presented in part by Public Supermarkets, Five-Star Credit Union, Bozard Ford Lincoln, and Wolfson Children's Hospital. Opioid addiction, destroying families and local lives.
It's just euphoria. It takes away every worry and care in the world. And then it's also like, it's evil because then all you want is more.
Parents hooked on drugs, their children forgotten.
They're not cared for, they're not fed.
Solutions as complex as the problem itself.
I tried to stop a couple times, but I couldn't.
The battle being waged in every neighborhood, in every part of our community.
It's all over the city. It's not limited to certain areas. It's not down the alley behind a building. It's not that kind of a drug problem.
This is a special presentation. Action News Jax Family Focus, the Opioid Epidemic, local communities in crisis.
Good evening. I'm John Bachman.
And I'm Tenikka Hughes. The cost of the opioid epidemic is staggeringly high, tearing apart local families and our communities.
For the next 30 minutes, we're digging into how we got here and the local solutions that are working to help beat these powerfully addictive drugs.
And let's start now with a look at the problem. The federal government says that 115 Americans die every day after overdosing on opioids. That's about 42,000 people a year. There are an estimated 2 million people who abuse prescription opioid painkillers and another 600,000 who are addicted to heroin. The CDC says the total economic cost of the epidemic is $78.5 billion a year. In Northeast Florida, Jacksonville is ground zero for the epidemic.
Its signs are visible inside family homes in every part of town, in jail cells and hospitals, and in the medical examiner's office.
Take a look at this map, which shows the distribution of Jacksonville's 2017 opioid overdoses. 12% of them, the largest percentage, were in zip code 32210, near Jacksonville's west side. That's more than 400 overdoses. JFRD transported nearly 3,700 overdose patients to local hospitals. It costs about $1,000 a patient, or roughly $3.6 million in 2017. That's doubled since 2015.
There are three main types of opioids: the illegal drug heroin, powerful synthetic opioids like fentanyl, and legal prescription drugs like OxyContin or Vicodin. In addition to giving patients relief from pain, they produce a powerful euphoria. When used responsibly, the legal varieties of the drug provide legitimate pain treatment for patients. However, millions of Americans have fallen into addiction. The federal government says about 25% of patients misuse their prescriptions, about 10% become fully addicted, and 5% make the jump to heroin when they can no longer get opioids legally.
The resurgence of heroin is fueling the deadly epidemic. While getting prescription medication is getting more difficult, heroin is easy to find and cheap. Action News Jax Paige Kelton spoke with a local mom who calls it a dream killer.
My son's name was Jeremy. He was 24 years old. I'm sorry.
1 week after his 24th birthday, Jeremy Davis died of a heroin overdose.
He was dead for 3 to 4 days, they said, before they found him. He still had a needle in his arm, slumped over against the wall, sitting on a toilet, fully dressed.
His death is part of a growing trend. Florida's health department says the number of drug overdose deaths went up 55% from 2016 to 2017. Heroin accounts for more than a third of those deaths.
When did you first use heroin?
About 14.
14 years old. Where'd you get it?
I'd rather not say.
How powerful is this drug? I mean, what is it, as soon as it enters your body, what does it feel like?
There is no word to describe it. It's just euphoria. It takes away every worry and care in the world. And then it's also like, it's evil because then all you want is more.
Sarah is a recovering addict. She's one of the lucky ones.
Where are these drugs coming from?
Well, obviously your heroin and cocaine, the bulk of that comes out of Mexico into Texas and then filters out from there to the different states.
In Jacksonville, this 2016 medical examiner's report shows the majority of heroin-related deaths involve people 34 and under.
It's skewing younger and younger.
Bill Gaylor is clinical director at Beach's Recovery.
Can you ever beat your addiction?
Sure, yeah.
But Sarah tells me winning that internal battle with the drug takes excruciating effort, a willingness to change, and both professional and family support.
I thought I was destined to die. I was just another junkie, living behind a grocery store, sleeping in a tent. And today I'm employable. I have family back, and I'm happy. So it's possible.
But for others, like Jeremy Davis, the call for help came too late. The 24-year-old had filled out an application to enter rehab. He died with it still sitting in his car.
He would sit right here and tell you, Mom, I hate being an addict. You don't know how I feel. You know, he says, I don't know how to stop, and I don't know how to stop him.
Every 19 minutes, a baby is born with a painful, preventable illness. They're born addicted. The opioid epidemic is devastating families and filling local morgues, but the drug continues to explode in our area. And these children are the unintended victims and can sometimes face lifelong challenges. Adriana, who goes by Addie Ann, is a thriving 2-year-old.
Throw it. Throw it like you throw your bottle.
We first met Addie Ann and her parents, Frank and Karen Byrne, a year ago. They took her in and adopted her after she was born 6 weeks premature, severely underweight, and addicted to opioids.
She fit in my hand.
The woman who gave birth to Addie Ann is Karen's daughter.
I was very distraught. My daughter, you know, she was my world, you know. And all of this, I was really naive and didn't want to believe the extent of the problem that she had.
When babies are born with drugs in their system, DCF investigates and works to get resources to the family through partnerships with community agencies. Daniel, the oldest children's agency in Florida, is a part of that network.
We know that 1/3 of the cases who are coming to us now are because of substance abuse, opiate use.
Daniel's CEO, James Clark, says the problem is getting worse, not better. According to the CDC, the number of children born addicted to opioids in Florida has increased tenfold since 1995, more than double the national rate. Daniel helps get parents clean, the goal to reunite them with their children, but sometimes that's not possible.
Anybody can help who wants to save a life. And that's really what you're doing when you're adopting or being a foster parent. You're actually helping save a life.
Addie Ann's life is full of love and adventure. She's healthy and reaching new milestones with Mom and Dad there every step of the way.
Coming up on the opioid epidemic, local communities in crisis. Doctors and pharmaceutical companies blamed for overprescribing.
It was a senseless death. It shouldn't have happened.
How lawmakers are taking action in medical offices and in courtrooms. You're watching Action News Jax Family Focus, the opioid epidemic, local communities in crisis. Presented in part by Public Supermarkets, ViStar Credit Union, Bozard Ford Lincoln, and Wolfson Children's Hospital.
Her eyes were rolled back. Her fingers were already purple. And I was trying to perform CPR.
More and more parents are finding their children in the grips of an overdose. And often they're not getting the drugs on the street, but from doctors. New data shows that millions of dollars are paid by drug companies directly to doctors to encourage them to prescribe opioids.
These payments come in the form of expensive dinners, free trips, and researchers found 1 in 5 family doctors have taken money targeted to promote opioids.
At this point, the dangers of prescription opioids are well known. But now, researchers have found that between 2013 and 2015, drug companies paid 68,000 doctors more than $48 million to encourage opioid prescriptions. Brown University's Brandon Marshall is one of the researchers.
At the very least, what we hope is that this research prompts a discussion or closer examination of how these types of practices might be continuing to drive the opioid epidemic in our country.
The study found that drug companies spent more money pushing opioids than other pain relievers. Doctors were given gifts like trips, free meals, and sometimes large speaking fees. It's all legal.
Even if the marketing is technically legal, we think it's unethical for physicians to accept money from the makers of such a dangerous product.
Senator Chuck Grassley authored the bill that made the data available. He says this is information the public should know, but warns, quote, payments don't mean doctors are doing something wrong. But Public Citizen's Sami Almashat says there's a reason drug companies spend that money.
And any industry, any business does not engage in the same practice for decades if they don't see results. And the results in this case are higher opioid prescriptions.
The trade group representing drug companies wouldn't comment on the study, but said it supports training for doctors about when and how to prescribe opioids.
The city of Jacksonville is one of hundreds nationwide taking on the pharmaceutical industry over the opioid crisis. In March, the city filed a 144-page lawsuit in Duval County against more than a dozen drug companies.
They were selling this to the doctors very hard, and the doctors were told that it was not addictive when it really was.
The lawsuit alleges the companies engaged in mail and wire fraud, negligent misrepresentation, deceptive and unfair trade practices, and more.
Coming up on the opioid epidemic, local communities in crisis. Community problems require community solutions.
We can't throw police at these problems. What we got to do is get our communities engaged.
Action News Jax takes the issue to the public, detailing how local groups and government officials are chipping away at the crisis. You're watching Action News Jax Family Focus, the opioid epidemic, local communities in crisis. Presented in part by Public Supermarkets, ViStar Credit Union, Bozard Ford Lincoln, and Wolfson Children's Hospital.
You're losing valuable parts of our society. That's what's so crazy about this thing.
The solution to a community problem needs to involve the community.
The opioid crisis affects all of us in some way, directly or indirectly, by putting a strain on first responders and healthcare workers.
Action News Jax partnered with PACT Prevention Coalition in St. Johns County for a town hall discussion on how to curb this crisis.
People are like, oh, you know, you can get addicted to opiates. No, 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 no. You can overdose and die.
Anna is a recovering opioid addict.
I've been clean since November 8th, 2017, almost 6 months.
For her, addiction started in her teens, prescription painkillers for a knee injury. It then spiraled out of control.
We can't throw police at these problems. What we got to do is get our communities engaged, and especially the ones who aren't affected today, because they may be affected when that grandkid hits the 8th grade.
Right now, several agencies are fighting the opioid crisis. They're doing great work. But in Florida, from 2015 to 2016, the drug overdose rate grew by 46.3%. Preventing the problem in the first place is much more complicated.
Prevention is hard to measure. You cannot say how many people you've saved. But the crisis is increasing, so we know we have to do more, right?
If I would have had somebody to talk to, I can't tell you where I'd be or what would have happened, but I can tell you it could have been a start.
The solution is complex. At the town hall meeting, our panel of experts talked about changing our culture of painkillers.
We are trying to change a culture not only in the healthcare system, but those people who have been treated by that healthcare system.
One of the panelists was Captain Michael Coy with the Florida National Guard. One of his focuses is drug takebacks. Last year in Clay County, one collection was staggering.
In 4 hours, we collected 540 pounds of prescription drugs. I mean, it was astronomical. And the common theme with everybody that we talked with as they were coming to turn in these medications was we didn't know what to do with them.
Each panelist deals with different aspects of the opioid crisis, but they all asked for the same thing to help them fight it: more resources. In March, Epic Behavioral Health, a 10-bed St. John's treatment center, had 108 people on the waiting list.
Well, I think we really have to be citizens, be voters, be a strong voice, and talk about the importance of dollars for resources.
It is a community problem, requiring the community to solve it.
President Donald Trump unrolled his plan for fighting the nation's opioid epidemic. It's a tough-on-crime initiative that could include the death penalty for some drug traffickers. First Lady Melania Trump introduced the president in New Hampshire.
I'm proud of this administration's commitment to battling this epidemic.
The White House chose the Granite State as the backdrop for announcing the president's opioid plan, a place he once described as a drug-infested den.
I see what you're going through. About as bad as there is anywhere in the country.
The president's initiative is getting the most attention for its crackdown on drug traffickers.
If we don't get tough on the drug dealers, we're wasting our time. Just remember that. We're wasting our time. And that toughness includes the death penalty.
And the president repeated his demand for a wall on the Mexican border, saying it will stop the flow of illegal drugs. The White House is also taking aim at the healthcare industry, looking to stop the overprescription of powerful and addictive painkillers. The goal is to reduce opioid prescriptions by a third within 3 years.
Coming up on the opioid epidemic, local communities in crisis. The path to recovery is a difficult one.
I was taking fentanyl, it just made me feel better. It made me feel really numb. So it was like an obsession inside of me.
How a groundbreaking local pilot program has turned emergency rooms into an emergency intervention, saving lives and money. You're watching Action News Jax Family Focus, the opioid epidemic, local communities in crisis. Presented in part by Public Supermarkets, ViStar Credit Union, Bozard Ford Lincoln, and Wolfson Children's Hospital.
I thought that I could do it by myself. I thought I could wean myself off of things and be okay.
For people who are desperate to overcome their addiction, there's help out there.
Locally, Gateway has been saving lives and restoring families for almost 40 years in Jacksonville.
Action News Jax photojournalist Joel Lotz introduces us to one woman on a path to recovery.
My name's Brittany. I'm 30 years old. I'm from Nassau County. I think I took my first opioid when I was 16. I ended up stealing them from my mom, who had had back surgery at the time. At 20 years old, I was taking fentanyl. It just made me feel better. It made me feel really numb. So it was like an obsession inside of me. I spent 3 years doing that. I tried to stop a couple times, but I couldn't. Half of my head wanted to use, the other half was like, I can't. I thought that I could do it by myself. I thought I could wean myself off of things and be okay. I needed a group of people. I needed support. When I got to Gateway, I just felt like inside of me, I knew I needed to come here. About 3 weeks into being here, something just clicked. I was working things out. I wasn't numbing myself from them and hiding from them. I needed to hear that a different way of life can be found. You do this for yourself, but also for the people that stayed up worrying about you at night and worried if you're gonna make it home or not. I didn't care that my daughters would stay up at all hours of the night waiting on me. It just wasn't even a thought that crossed my mind, and now when I think about it, it's heartbreaking. I did that to them. If they can forgive me, then anybody can forgive them, because I put my family through a lot of crap. Completely changed. Before, I was a very selfish person. I didn't care about anybody or anything but myself, and now I'm like, who can I help? What can I do to help? I've seen my kids since I've been here. I have a relationship with my mom again. I have a relationship with both of my sisters again. I don't think if it wasn't for this place, I wouldn't be alive today. Full of life.
Oh my, that is awesome. I'm excited about that. That's good. Excellent. You feel full by that.
I'm back to being Brittany. I don't know, it's just amazing. I'm so grateful to Gateway. It's really saved my life.
From the emergency room straight into a recovery program.
It's called Project Save Lives, and it's done just that. More than 60 lives since its creation late last year.
Action News Jax Paige Kelton introduces us to the local doctor who came up with the idea and its secret to success.
2 words you don't often hear associated with the opioid epidemic.
No deaths.
Dr. Raymond Palm is the medical director and creator of Project Save Lives. Since its inception in 2017, more than 60 people have gone from an overdose to the ER straight into addiction and recovery programs. Only 2 people relapsed. No one has died. The process is straightforward.
First, the family, while the victim of the OD is being stabilized, we're offering resources, also nasal naloxone for the family to take home. And then once the victim has been resuscitated and is stable enough, we then work with them directly.
Margaret Brown is one of dozens who say they're alive because of this program. She's now walking the path to recovery.
I've been an addict, heroin and cocaine for a year now. And in just that short period of time, I have destroyed a lot of things.
Dr. Palm tells me the real miracle workers are the peer recovery specialists, people who have overcome their own addictions and been trained to help others do the same.
When someone walks in and they've been there and done that, It's an immediate connection.
Project Save Lives operates out of 2 St. Vincent's hospitals in Jacksonville, but its success has sparked expansion in as many as 2 more.
They didn't let me just lay there and do what I thought was going to happen. And that has really gotten me to where I'm at right now.
98% of the funding for Project Save Lives comes from the Jacksonville City Council. And that money is stretching farther than anyone imagined. The results have exceeded expectations.
I thought we would help, but I had no idea it would be like this.
Project Save Lives is now being closely watched by communities across Florida, hoping to mirror its success in living up to its name.
Recovering from addiction is a lifelong process.
There's a community of people dedicated to helping you or someone you love get clean and stay clean. Narcotics Anonymous, or NA, holds nearly 60 meetings every day in our area. Similar to Alcoholics Anonymous, people in recovery support one another in their toughest times.
You can find a list of meetings and resources on our website, actionnewsjax.com. There's also a 24-hour helpline for people in crisis. That number is 904-723-LOVE. Thank you for joining us for a deeper look at this difficult issue.
In our history, Americans have overcome many seemingly insurmountable problems.
Together, we can beat this one too.
This has been an Action News Jax family-focused special, The Opioid Epidemic, Local Communities in Crisis.